Hello, Miss Smith. My name is Jamie, and I'm going to be your nurse for today. I'm going to be doing your assessment. So after I wash my hands, then we can get started.
Okay.
All right. If you have any questions or concerns, just let me know while we begin. Okay.
Okay, sure.
First thing I'm going to do is I'm just going to check to make sure everything is symmetrical.
Okay.
Your line symmetry is good. Okay. Everything looks good. Okay. The first thing I'm going to do is palpate,
Okay.
and just let me know if you have any tenderness.
Okay.
Do you have any tenderness?
No, ma'am.
Okay. Okay, good. The next thing I'm going to check for is tactile firmness, okay? And I'm going to do the same thing, just say 99 this time.
99.
Okay.
99. 99. 99. 99. 99.
Okay, good. The next thing I'm going to do is I'm going to percuss, okay?
Okay.
Okay. The next thing I'm going to do is I'm going to listen, okay?
Yes.
So can you breathe in for me? And breathe out. Okay. Okay, good. Everything is clear. Everything sounds good. Okay, so what I just did to the back, I'm going to do to your front, okay? So can you just turn your body this way?
Sure.
Thank you. Okay, so the first thing I'm going to do is just check and make sure everything is symmetrical and
Okay.
everything looks good. Okay, the first thing I'm going to do is I'm going to palpate and just let me know if you feel any tenderness, okay? Do you have any tenderness?
No.
Okay, right here.
Mm-mm.
Okay, good. The next thing I'm going to do is check for tactile firmness, okay?
Mhm.
So I'm going to do the same thing, just say 99 this time.
99.
Okay, good.
99. 99. 99. 99. 99.
Okay, and the next thing I'm going to do is percuss.
Okay.
Okay, good. And the last thing I'm going to do is listen. Okay. Okay, do you have any pain
No.
while breathing?
No.
Okay, good. So the next thing I'm going to do is I'm going to check for your for your heart and neck vessel assessment, okay?
Okay.
So the first thing I'm going to do is check your carotid arteries, make sure that everything is okay.
Mm-hmm.
Okay, they're strong bilaterally. Okay, good. And the next thing I'm going to do is I'm going to listen to it with the bell of my scope.
Okay.
Okay, good. Okay. So the next thing I'm going to do is I'm going to listen to your chest, and I'm going to listen to your aorta. I'm going to listen to your aorta, your pulmonic artery, your tricuspid, and your mitral, okay?
Okay.
So you got your aorta, your pulmonic, your air point, Earth's point, tricuspid, and your mitral. Okay? And next thing can you lay down for me?
Sure.
Good.
Okay.
And I'm going to do the same thing as well.
Okay.
But this time I'm going to look to make sure you don't have any jugular vein distension, okay? So can you turn your neck to the left for me?
Okay.
Okay, and then to the right?
Mm-hmm.
Okay, good. And I'm just going to make sure that your what's the word? Your pericardium is good and straight, okay?
Mm-hmm.
So everything looks good. All right, next thing I'm going to do the same thing that I did while you're sitting up. I'm just going to listen to it while you're laying down, okay?
Okay.
So you got your aorta, your pulmonic artery, you got your Erb's point, your tricuspid, and your mitral. And do you have any tenderness?
No, ma'am.
Okay, good. I'm just going to palpate, okay? Okay, good. Any tenderness?
No.
Okay. And can you turn to your right side so that way I can feel your mitral valve? Okay, good. S1, S2, it sounds good. They're present. All right, next thing I'm going to do is I'm going to go to your stomach assessment. So, first thing I want to do is I just want to look, make sure that everything is aligned. So your umbilicus is in midline. No abdominal striae. Peristalsis is not visible. Your abdomen is flat, no distension. Okay, so that's good. So next thing I'm going to do is listen to your bowel sounds, okay? Okay, your bowel sounds are present in all 4 quadrants. The next thing I'm going to do is listen to your vascular sounds, okay? So you have your aorta. You have your renal artery. Your iliac. And your femoral. Okay? That's good. Then next I'm going to do a light palpation, okay? Press and let me know if you have any pain or tenderness.
Nope.
Okay, good. And the next thing I'm going to do is make sure you don't have any pain or tenderness for your liver, your spleen, and your kidneys. Okay. So can you take a deep breath on me and then let it go as I press down? Do you have any pain right there?
No.
Okay, so liver not palpable. And can you do it again? Do you have any pain?
No.
Okay, so spleen not palpable. And then do it one more time for your kidney. Any pain?
No.
Okay, what about on this side?
No.
Okay, good. So next we're going to go to your advanced techniques, okay? The first one is going to be a Murphy sign. That's basically checking for your gallbladder, okay? So can you breathe in and breathe out? Do you have any pain right in that area? Okay, good. So next we got your Bloomberg sign. And that checks for rebound tenderness, okay? So I'm just going to press down. Do you have any pain?
No.
Okay, good. The next is your Rossing sign, and that just checks for referred pain. So I'm just going to feel on your umbilicus, and I'm going to let go and tell me if you have any pain towards your back or front area.
No.
No? Okay, good. And the last thing we're going to do is your ilio muscle test, and I'm just going to raise your leg up.
Okay.
Do you have any tenderness?
No.
Okay, good. All right, and then next thing I want you to do is I want you to bend it, okay? And I'm going to hit the foot. Do you have any pain?
No.
Okay, good. So, thank you, Ms. Smith. That'll be the end of that.
Thank you.
Okay, so today we had a 54-year-old patient come in for an assessment. Everything was normal. Her respiratory sounds was equally symmetrical. APT diameter was 2 to 1. Patient used no accessory muscles. Her arteries was palpable, strong bilaterally, no jugular vein distension. S1, S2 sounds were present. No tenderness upon palpitation. Abdomen was smooth, no abdominal striae. Everything was symmetrical, no scars noted. Patient, all her tests, her advanced tests came back negative, so she was fine with that. Abdominal vascular sounds were non-audible.